Kalemias do the same as the prefix except for heart rate and urine output. Potassium imbalances do the same as the prefix except for heart rate and urine output. You memorize that. So what I'm telling you is when you get a kalemia, just look at the prefix. There are only two options, hyper and hypo. Hyper means everything is what? High, and hypo means it's low. And your symptoms will go high with hyper and low with hypo because it's doing the same as the prefix. Except for the heart rate and urine output, which will go opposite of the prefix. So with hyper, urine output and heart rate go down, and with hypo, urine output and heart rate go. So if you talk about the brain, what symptoms are hyper signs in the brain? Agitation, restlessness, irritability, aggression, obnoxiousness, decreased inhibitions, loud. Those all go with hyperkalemia. All right, well, let's talk about the lungs. What are you going to see there? Tachypnea. What are you going to see in the heart? Low heart rate, because there's an exception, but the T waves will be peak, tall. The STs will be elevated. So the only thing that goes up is the heart rate. Everything else about the heart goes with the prefix. Okay, what will you see in the bowel? Diarrhea, borborygmi. What will you see in the muscle? Spasticity, increased tone. What will you see in the reflexes? +3, +4. They're all up. Why are they all up? Because you have hyperkalemia. And in kalemias, they do the same as whatever the prefix says they are, except for the heart rate and urine output, which goes opposite. So what would you list for hypokalemia? Lethargy, tachycardia, because it's going to go opposite there. Tachycardia and polyuria. What? Bradypnea, bowels are going to be what? Slowed down, so what might you have? Ileus, constipation. What are you going to see in your muscles? Flaccidity. What are you going to see in reflexes? Do I want you to memorize these lists that we're generating? No, because you can get those lists from the saying that says what? Kalemias do the same as the prefix except for heart rate and urine output. Your patient has hyperkalemia. Select all that block. Adynamic ileus, obtunded, +1 reflex, clonus, U wave, depressed ST, polyuria, bradycardia. Kalemias do the same as the prefix except for heart rate and urine output. And draw your arrows. So you're going to have to draw an arrow, and you're also going to have to draw the exceptions, the heart rate and the urine output. A U wave. A U wave is a wave that goes like this. It goes what? Down. Okay, how many did you select? Okay, I selected 2. Let me see if I'm wrong. Because I'm going to write my arrows out first. I see hyper, and I know kalemias do the what? Same, so it's going to make everything go up, but heart rate's going to go down, and urine output's going to go down. Okay, A, dynamic, without movement. Ileus, that's down. That does not fit. Obtunded, that is down. That does not fit. +1 reflex, that is down. That does not fit. Clonus, that is irritability. There we go. That fit. U wave, it goes down. That doesn't fit. Depressed ST, it's going down. That doesn't fit. Polyuria, oh no, it should be oliguria. That doesn't fit. Heart rate down. Bradycardia, yeah, that fits. You gotta write your arrows. Don't look first and then go back and write arrows. Know what you're looking for first. The U wave, a U starts on the baseline and goes down from the baseline. So it's a sign of cardiac depression. And the idea, though, Leonid, is if you don't know what something is on a select all that apply, don't pick it. Obtunded is just a little more comatose than lethargy. Lethargics will respond, but it's going to take a while to get it out. Obtundids will never respond, but they're rousable. Stupor and obtunded are often considered to be the same idea. Stupor is more a generic word. Obtunded is more the medical term. Okay, calciums. Calcemias do the opposite of the prefix, which means if your calcium goes high, everything goes low. And if your calcium goes low, everything goes high. So hypercalcemia, what would you have? Bradycardia, bradypnea, flaccid muscles, hypoactive reflexes, lethargy, constipation. Everything goes down when calcium goes up. However, when calcium goes down, hypocalcemia, everything goes up. So what do you get with hypocalcemia? Agitation, irritability, clonus, +4 reflexes, spasm, irritability, seizure, tachycardia. And you get 2 other things, Chavasse-Tex sign and Trousseau's sign. Chavasse-Tex Chavostex starts with what two letters? CH. And what do you do to elicit it? You tap the cheek. So just think Chavostex cheek, Chavostex cheek. When you touch their cheek with Chavostex, they go into a spasm of the face. Their face spasms, which shouldn't happen. It's a sign of neuromuscular irritability associated with a low calcium. Why does that sentence make sense? Because calciums do the opposite, so irritability would have to be low calcium. The other sign is Trousseau's. Trousseau's is when you put a blood pressure cuff on their arm, you pump it up and they go into a spasm of the hand. So it's a hand spasm when you put a blood pressure cuff on. So Chavostex, you do what? Cheek. Trousseau's, you do blood pressure cuff, and look for that. Stupid way I remember this. Trousseau sounds like a French name. I think of an effeminate Frenchman, and he says, I'm Trousseau. What if I change this to hypercalcemia? Would it change the answer? Yeah, because now you're looking for what? Calciums do the opposite. This says hyper, so it's going to make everything go. Like for the hyperkalemia, if they ask you which one of those was most likely, you'd have narrowed it down to two. Which two? Clonus and bradycardia. But because it was potassium, you'd give the edge to the heart. If they're talking calcium, you'd have all these things, but you'd give the edge to the muscles and the nerves. But make sure it's the right thing first before you do it, you know what I mean? But if you're between a couple of signs for potassium that aren't correct, and they're asking you to pick between them, for potassium, pick the heart sign, but make sure it's going the right way. Prefix, correct? And when you're talking about the calcium, pick the skeletal muscle and nerve, but make sure it's going the correct way. Magnesiums do the opposite of the prefix. Hypomagnesemia is associated with hypertension. Magnesiums do the, so a hypomag would result in high blood pressure. As some books say, no, that's not true. Go investigate and you'll find that low magnesium is associated with hypertension. So magnesiums do the what? Opposite. Could it be possible that a certain symptom could be caused by a magnesium imbalance, or a calcium imbalance, or a potassium imbalance? Could that happen? Sure. Well, here's the tiebreaker. In a tie, don't pick magnesium. Why? It's not a major player. So it's probably not the magnesium that's causing the problem. Number two, if it is skeletal muscle or nerve, blame it on calcium. For everything else, blame it on potassium. So let me show you what I'm talking about here. Your patient has diarrhea. What caused it? Hyperkalemia, hypokalemia, hypocalcemia, hypomagnesemia. You know it's an electrolyte question, right? So, is this symptom up or down? So you gotta find something that causes stuff to go up, the bowel to go up. Potassiums do the what? Same. So hyper makes everything go. So could that cause that? So that's a possibility, is it not? Kalemias do the same. Hypo makes everything go down. Could that cause that? No, that's out. Calciums do the opposite. So hypo makes everything go up. So could that cause that? Yes. Remember, they're in the same direction that could cause it. Magnesiums do the opposite. So hypo makes everything go up. So could that cause that? Yes. So we have a what? Tie. So we rule out D. Is this skeletal muscle or nerve? No. So what do we rule out? Calcium. So we blame it on the high potassium. So let me show you what mistake people make with electrolytes. Your patient has tetany. What caused it? A high potassium. B, a high calcium. C, a low magnesium. 90% of students taking this question without understanding what I just taught you would pick for this one, the high calcium. Because they've got burned in their brain, calcium muscles, calcium muscles. Muscle is calcium, right? So they're going to pick high calcium and they're going to be dead wrong. Why? You've got to use your sentences first. Potassiums do the same, so this could cause that. Calciums do the opposite, so that's going to make everything go down. That would be ruled out. See how the answer that everybody would pick should be the first one ruled out, because they're not using what? Their sentence. And they just think muscle, calcium, potassium, heart. And they don't even look to see if it's going the correct direction. If it's potassium, it's heart. If it's calcium, it's muscle. And then you don't even look at the prefix. Okay, so look at the prefix first, then use potassium, heart, calcium, muscle for tie breaking. Yes, this could cause that, this could cause that, and this could cause that. Okay, now our tiebreaker is in a tie. Don't pick magnesium. If the symptom involves skeletal muscle, which it does, pick the calcium. And you don't have to go any further. But you got to go through for the first time to make sure that your prefix agrees with the symptom. Talk about sodiums. Do you see the one with the E? I want you to write dehydration. The one with the E, hypernatremia, is associated with dehydration. Do you see over in the other column the one with the O? Write the word overload down from that. Overload. Aren't dehydration and overload opposites? So when you get a hypernatremia, what should you see? The letter what? E, which tells you it is the same as dehydration. And when you see hyponatremia, you should see the O and say that's the same as fluid overload. So here's how you would use this. The one with the E is dehydration. The one with the O is overload, and you're using sodium here. So if they said this, a student nurse runs to you, the LPN, and says, oh my goodness, I just ran an IV, a whole liter of IV fluid into the patient in 10 minutes. I forgot to close the clamp. What electrolyte imbalance would you expect to see? Why did you say hyponatremia? Because they would have had fluid overload, and you'd have been absolutely 100% correct. Which patient is put on a fluid restriction and Lasix? Hyponatremic. Which one is given lots of fluids? Hypernatremic, because that's dehydration. Who has hot, flushed, dry skin? Hypernatremia, so that's the one with the E, so that's dehydration. So here's my point. If you had a 20-question test over dehydration and fluid overload versus a 20-question test on hypernatremia and hyponatremia, which one would you rather take? The dehydration overload. But what's the reality? It's the exact same test. Because anytime you see dehydration, you say what? Hypernatremia. Whenever you see overload, you say hyponatremia. So in addition to a high potassium, what other electrolyte imbalance is possible in DKA? Hypernatremia. Why? Because wherever you see the word dehydration, you can throw in the word hypernatremia. Anywhere you see hypernatremia, you throw in the word dehydration. So what nursing diagnosis would be major for hyponatremia? Fluid volume excess. Or SIADH would have hyponatremia. DI would have hypernatremia. And HHNK would have hyper, because HHNK is the same as dehydration, which is the same as hypernatremia. So what do you have to know your electrolytes? Kalemias do the same as the prefix except for heart rate and urine output. Calciums and magnesiums do the opposite. The one with the E is dehydration. The one with the O is overload. Now, if you use those, kalemias do the same as the prefix except for heart rate and urine output. Calcium, magnesium do opposite. The one with the E is dehydration, one with the O is O. Could you give me 15 signs and symptoms of hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia, hypermagnesemia, hypomagnesemia, hypernatremia, and hyponatremia with 80% accuracy? Who could do it? And are you memorizing stuff? No. But you need to memorize